Morning, everybody. This is a 72-year-old man who presented with backache. His MRI revealed altered marrow signal intensity with abnormal enhancement involving the D5 and the D6 vertebral bodies and abnormally enhancing soft tissue component, compression fracture involving D6 vertebral bodies and causing compression of the thecal sac, cord parenchyma, resulting into severe spinal canal stenosis. We received two blocks for second opinion and IHC studies. The histology revealed a typical plasmacytoma composed of neoplastic plasma cells having eccentric nuclei with clumped chromatin and moderate amount of eosinophilic cytoplasm. Binucleated and few multinucleated forms were also seen. The mitotic activity was 2 to 3 per 10 high-power field. The intervening stroma was scanty and presence of amorphous eosinophilic material was noted. Now, morphologically, this could be show mature, immature, or plasmablastic morphology. A typical cartwheel appearance of the nuclei is seldom seen. The other features such as Russell bodies, that is presence of hyaline intracytoplasmic inclusions, may be noted, or Mott cells, which are grape-like structures in the cytoplasm, may be seen. Now, this is a typical slide of the plasmacytoma. You can see round monomorphic nuclei and which is eccentrically placed and moderate to ample amount of eosinophilic cytoplasm. And the intervening stroma showing amorphous eosinophilic material. Now, this could be amyloid also. We did immunohistochemistry, which was positive for the plasma cell marker, that is CD138, and it was monoclonal positive for kappa light chain. The lambda was negative. So, and the MIB1 was 12 to 15%. We advised bone marrow biopsy, serum electrophoresis, and urinary Benz-Jones protein to rule out multiple myeloma. So, a diagnosis of plasmacytoma of the D6 was given. So, solitary plasmacytoma of bone are localized bone tumors consisting of monoclonal plasma cells with no other radiographic lesions and no evidence of bone marrow involvement. Up to two-thirds progress to myeloma or additional plasmacytomas develop. One-third remain disease-free for more than 10 years following local, that is radiation. 5% may develop multiple or recurrent plasmacytomas with no evidence of myelomas. Now, multiple myeloma is a clonal B-cell disorder characterized by proliferation and accumulation of B lymphocytes and plasma cells in the bone marrow and rarely at the extramedullary sites. It is the second most common hematological malignancy after non-Hodgkin's lymphoma. Bone disease occurs in 80% of patients with a newly diagnosed multiple myeloma. Now, these are most common in the elderly age group. 70% of patients present with bone pain as a first symptom. The other features are like they present with pathological fractures, osteolysis, osteoporosis, and skeletal related events. The vertebral lesions may result in pain, permanent deformity, kyphosis, impairment in walking, or paralysis. Now, how the diagnosis is done on imaging, it can be done on whole body skeletal X-ray, and these lesions become evident whenever there is over 20% trabecular bone is lost. Multiple punched out or lytic lesions become visible when there is more than 50% destruction, which is caused by the osteoclastic bone resorption via rank, IL-6 and MIP-1 alpha. One can do CT scan. It allows a higher detection rate for these bone lesions. MRI is again more sensitive. One can differentiate between pathological fracture due to benign osteoporosis or plasmacytoma. One can go for CT, PET CT, FDG PET. And coming to laboratory investigations, anemia is the most common finding, elevated creatinine, hypercalcemia, elevated ESR, and serum protein electrophoresis. We see the presence of M band, that is M band spike is seen. In urine, we see proteinuria, and one can do protein electrophoresis, and Benz-Jones protein may be demonstrated. Now, treatment of multiple myeloma related spine lesion is mainly multidisciplinary approach. Medical line of treatment may be given, that is anti-myeloma drugs may be administered, and surgical and minimally invasive techniques are employed to the specific vertebral lesions. Thank you. Have a good day.